Anyway, a little bit of background for this. Why do we think this is important? Well, despite, as we all know, and that's why we're here, despite having the most beneficent welfare states in the world, Nordic countries do not generally achieve higher health equality than other countries. This has become known as the Nordic health equality paradox. Some argue that this may be partly due to the education systems, as we heard in the previous session. Education indeed appears to be a more important explanation for health differences than income in many settings. And some people also argue that the educational dividend in the Nordic region specifically may partly reflect the country's knowledge-intensive labor markets, which demand knowledge and skills that lower educated individuals do not necessarily possess. So it is important to investigate the extent to which Nordic education systems are likely to contribute to or counter health inequities in the population at large in this respect. And why would we think that education is important for health? Well, there are plenty of different mechanisms. I'm just going to mention a few. The first one is that education may increase the productivity of individuals in the health production. So just as we believe that education may improve or increase productivity of people in the labor market, so we think that they become more productive in improving and sustaining their own health. It may also improve the ability of individuals to process health-related information and make decisions concerning their health. And the argument then is that that would in turn change behavior in a positive direction, such as decreasing smoking rates and alcohol consumption. Education may also increase lifetime earnings, and if it increases lifetime earnings, it should also increase the marginal value of health, because in order to increase your outcome, you have to be healthy, so you can join the rat race and go work during the day. And therefore, you also have stronger incentives to invest in your health and to sustain it. And finally, education may also decrease stress via an increased sense of control and also other personality changes. And these are just a couple of mechanisms. There are plenty of others. Plenty of other stories we can come up with. But the main conclusion from all those stories is that more equal distributions of education should lead to more equal distributions of health outcomes in the population. But it's very important to understand that it's not just the number of years spent in the education system of educational levels that should matter, but also specifically what one learns and what skills one develops during those years. I mean, education is not a direct measure of knowledge and skills. It's an indirect measure. In fact, it's an input into the production of cognitive skills and non-cognitive skills, such as conscientiousness and other things we find to be important, which are assumed to be positive for health. So it's not a direct measure of skills. So this indicates, theoretically, that inducing more people just to attain higher levels of education, as we've done in the Nordic countries for the past 50 years, is unlikely to be a sufficient strategy. It may be important, but it's unlikely to be sufficient from a health equality perspective. And to analyze whether or not it's reasonable to believe that inequality in knowledge and skills may have something to do with this Nordic health equality conundrum. I looked at the PIAC survey, and PIAC is basically, it's an international survey taken, or a test in numeracy and literacy, taken by representative samples of populations in, well, about 30 countries now have sat the test. And I compare then the standard deviation in this test across population. And a higher standard deviation obviously increases higher inequality of knowledge and skills, and a lower standard deviation indicates a lower inequality in skills. And it's pretty clear that when we look at this, that the Nordic countries do not stand out as particularly equal. I mean, Sweden has the highest standard deviation after the United States in the first round of PISA 2012. These are the average score in numeracy and literacy. Denmark is the most equal country, but it's far from the kind of bottom end there, where we find countries like Japan and Korea, which are much more equal. So I argue this doesn't show that knowledge and skills are important for understanding the health equality paradox, but it at least suggests it's a reasonable hypothesis to have that knowledge and skills may be important. And further supporting this hypothesis, I argue, I show that PX scores are a very strong predictor of employment in the Nordic region. We heard from the previous presentation that, as I said, there might be something to do with the kind of demands on the labor market that shut some people out in the knowledge-intensive labor markets of the Nordic countries. So what I did was that I looked at the relationship between PX scores at the individual level and the probability of being in full-time employment and adjusting for various background characteristics such as gender, age, parental levels of education, immigrant status, and so on. And what we can see, I also standardized. So what I looked at, I standardized the PX scores to have a mean of 0 and a standard deviation of 1 at the country level, because we're looking at relative differences within each country. And what we can see here is that the Nordic countries actually come out on top. So the relationship between knowledge and skills and the probability of having full-time employment is larger in the Nordic countries than in any other of the countries in this comparison, at least. And these are all the countries from PIAC 2012 for which we have data. And this is interesting because previous research actually suggests that wage returns to these PIAC skills are quite low in the Nordic countries. But then I looked a bit closer and I thought, this is weird. Why is it like that? Well, it turns out that they only compare individuals who already have full-time employment. So then when I looked in the appendix, they include all individuals, including those who are outside the labor market, and suddenly they are higher. The wage returns are suddenly, they flip. So they turn from being the lowest in the Nordic region to the highest in the Nordic region. This suggests that if you are smart enough to be able to land yourself a full-time job, then increasing your skills is not going to do that much for your wages, but the threshold is very high. And again, this supports the idea that the distribution of knowledge is important for understanding health differences in the Nordic countries. Turning to the existing empirical literature, I mean, it's pretty clear that, which I review in my report, it's pretty clear that education is correlated with health in essentially all settings. At the individual level, but it's not clear whether this relationship is causal. So health may, of course, affect also your investments in education rather than the other way around. We may think that healthier individuals are probably more likely to engage in education, and also third variables may explain both health and education levels, such as genetic factors or family background. Could be many different things. There are different methods to get around this problem. I discussed them in the report. I'm not going to do so here. I don't have enough time, and it's probably quite boring. But they have different strengths and weaknesses. And my reading of this evidence is that overall, it's quite mixed, actually. In some cases, there are positive effects. In some cases, there are negative effects. In any case, there are several studies that do suggest that education has a positive impact on health, either directly or in an intergenerational perspective. So what I mean by that is if parents become more highly educated as a result of some random event, such as being subjected to a specific reform that increased their educational levels, their children's health in the future, when they're grown up, it's likely to be better as well. I would argue that the same conclusion applies to the Nordic region. It's mixed. But generally, if you look at all the different methodologies, I think you can say that there is a positive pattern there. It's also important to remember that in the Nordic region, most studies analyze the impact of the comprehensive school reforms on health in all the Nordic countries, essentially. And the problem with these reforms is that not only did they increase the number of schooling years in the population, but it also changed other factors of the education system. Specifically, it decreased the tracking and the streaming in the system. And research from England suggests that could have an impact by itself. In fact, decreasing tracking in England, streaming, had a negative effect on health because it increased smoking rates and alcohol consumption. Maybe because there were some peer effects that changed as a result of the reforms. It's very difficult to say anything specifically about the impact of education on health from these studies. But overall, I would argue that it's reasonable to assume that education has a potential to affect health, but that the exact benefits depend on the context and the type of education. Also important, of course, is that all of these studies that I mentioned in my review that analyze the causal effects of education focus on years of schooling or educational levels. And as I said in the beginning, that's unlikely to be sufficient. They do not analyze any direct measures of cognitive skills, non-cognitive skills. That research exists. It's much smaller, the literature, and it's less developed. But whatever evidence we do have does suggest that cognitive and non-cognitive skills such as conscientiousness, self-control are important for health. And by the way, we often think of test scores as a measure of cognitive skills, but research actually shows that test scores pick up both cognitive skills, so IQ, as well as non-cognitive skills. So when you look at test scores, they're kind of a combination of both important non-cognitive, such as grit, and those kind of popular things that we hear about in debate, as well as cognitive skills. And to analyze this further, I analyzed the relationship between PX scores and self-rated PX scores and self-rated health. Again, at the individual level, just as I did with the employment in the employment graph, I standardize both variables here at the country level because we're interested in inequalities. And as we can see here, I adjust for all the same background variables as well. As we can see, the relationship between PX scores and self-rated health is quite significant in the Nordic countries in a relative perspective. Denmark has the highest one, but Sweden, Finland, and Norway are not far behind. Can I just highlight also, I forgot to mention that Iceland has not participated yet in this survey, and that's why I don't have Iceland in there. Unfortunately, I hope it will participate soon so we can compare Iceland with the other countries as well. So there's little evidence here that the Nordic countries, again, stand out as equal. In fact, they stand out as quite unequal in this respect, and far from the levels of, say, Japan and Korea. In the report, I don't have time to show you that, but in the report I also analyzed directly the relationship at the individual level between PX scores and health differences. So I can show that PX scores are important for understanding health differences between socioeconomic groups and also natives and migrants in the Nordic nations. They're very crucial for understanding the gap in self-rated health between natives and migrants. So overall, I would argue that the North equality health equality paradox is apparent also when we analyze direct measures of knowledge and skills as well. And having argued all this, the question is then whether current education policies in the Nordic countries align with the goal of improving cognitive and non-cognitive skills so we can increase health equality. And it's useful to start with a little bit of background, and these are broad strokes. I discussed this in the report, and I also have a book coming out next year discussing this issue specifically in the Swedish context, but broad strokes, remember that. So between the late 1800s and World War II, Nordic education systems were heavily influenced by German pedagogical ideas, specifically one feature called Herbart-Sillerism. There's been, this was actually an innovation. We think about the traditional education system as very old, that it's always been like that. It was always something, and then we started to change it in recent years. In fact, the system was changed radically in the 1860s onwards. And obviously this idea, there's different things that have been emphasized, but there's a strong emphasis on the traditional goals of education, to increase subject knowledge, as well as non-cognitive skills such as self-discipline. That was supposed to be achieved through hierarchical school environments and a teacher-led instruction. And this was not only the Nordic countries that were affected by this. This idea spread all over the world. It affected America, Japan, China, pretty much everywhere during this time. But it did affect the Nordic countries, especially, and probably Sweden the most, because Germany was such an important influence for us culturally during this era. Of course, after the war, it was no longer viable to look to Germany as an inspiration for pedagogical ideas. In fact, many held that the old German system, this Herbart-Silleris system, was partly responsible for the crimes the regime had committed. I discuss again this in my book, and I do not believe that's the case, but that's a different story. So after the war, there's a new progressive paradigm has become known as, starting to influence education policy for real. This is not new. It had already emerged in education research around the turn of the century, with the writings of John Dewey, for example, Maria Montessori in the century before. But it started now to affect policy significantly. And a characteristic of this new paradigm was a strong criticism of the regimentation and the focus on factual knowledge in the old system, and a much stronger focus on the child. Sounds funny that we talk about before education should be for the child, but it's supposed to be much more focused on the child's well-being, and child-centered teaching, pupil democracy. Okay. The intellectual basis for this can be traced all the way back to Jean-Jacques Rousseau's Émile, which was published in the 18th century, came to have a huge influence on our concept of childhood, influenced Ellen Key, for example, and also especially in education. And I think that many people have read Rousseau in the wrong way, but it doesn't matter, because the interpretation that came to kind of be dominant was that the traditional education system is seen in this view as ineffective, unnatural, which is very important for Rousseau, obviously, and anti-democratic. And actually, Rousseau did believe that, but he didn't believe in some of the other stuff that they talked about. The solution for progressive educationalists was to individualize learning, promote pupils' own search for knowledge, have more pupil democracy, and generally decrease the role of authorities in education. These ideas became crucial for post-war Nordic education policy officially, but they took much longer to take root in Finland. So there's a good article on this by Ingrid Sahlgren from 2006, where they compare, there's et al. Actually, several authors in Scandinavian Educational Research Journal, where they compare the kind of evolution of this paradigm in the different countries. It did take longer to take root officially in Finland, but it did happen. But, and this is very important today, when we're talking about the importance of policy and the importance of curricula, etc. Oh, what's it say in the curricula? Curricula is not everything, or are not everything, because policy does not change practices immediately. In fact, there was a lot of resistance to these ideas among teachers in Sweden in the 50s and 60s. It took a long time to wear them down. So they finally accepted this new paradigm. And of course, the same, but something happened around the mid-80s. And what I show in my future book is also that this is related to a shift in values in society that align more with these progressive values. So we start to be, so Sweden moves from being some of the most collectivist countries in the early 80s to some of the most individualist countries in the early 2000s. And some of this stuff is very much aligned with this focus on the child. And it's only then when we see policy finally having an impact. So it started to snowball really from the beginning of the 1990s onwards. There's also some evidence from that practices in Denmark, Iceland and Norway came to reflect the paradigm. It's less clear cut, but it's there. But Finland is the conspicuous exception here. Practices remained traditional, okay? Very traditional. This was not for the lack of trying. I mean, the Nordic education policy elite did change policy with the 1994 curriculum, and there was an attempt to try to change this in a direction. It was much less significant than what happened in Sweden, but there was an attempt. But teachers there just ignore them. And that was the case for a very long time. So practices at the turn of the century here, there's little doubt that these ideas had come to influence education policy in all Nordic countries by the end of the 20th century. But there was a significant variation in degree to this policy affected school practices. Finland remained traditional. And historically, it's become difficult to compare pedagogical practices in a large number of countries. But in the past decades, a number of international surveys have emerged, which allow us to actually do so. And in the graph that I will show you, I focus on the OECD's index of overall pupil-centered teaching from PISA 2012, where pupils were asked about methods used in mathematics lessons. I do so because I believe that this index best captures this kind of pupil-centered teaching in general. There are similar results from other surveys as I will highlight. And as we can see, this index is standardized at the OECD level to have a mean of 0 and a standardization of 1. And as we can see, that basically all Nordic countries, apart from Finland, appear to be quite progressive. Sweden, in fact, has the most child-centered teaching methods in the OECD after Mexico. Who knew that Mexico would be up there? But in fact, it's interesting. It's actually a Latin American and a Nordic phenomenon, because Chile is the same. So Sweden has about 0.42, almost half a standard deviation score higher on this index than the OECD mean. Then you see Iceland, Norway, Denmark, a bit further down, and then you have Finland, which is in the middle of the country, but is still lower than the average. So it's pretty clear. Again, evidence from PISA 2015 and TALIS 2013, which is an international survey of teachers, display a similar picture overall. It displays slightly variation in exactly the type of pupil-centered teaching. So Sweden has more project work, for example, whereas Denmark stands out in having, I think, the highest level of group work. And Finland in TALIS and PISA 2015 is actually far more down there than in the middle here. So I'm being generous to Finland here that they're in the middle in this sense. It's also important to understand that Finland has moved in a progressive direction in the past decade and recently. It's difficult to engage the extent of these changes so far. There's another international survey looking at pupil democracy and the level of which pupils actually take part in decision making at the school. And that has completely snowballed in Finland between 2009 and 2016, still from very low levels, so actually the lowest level of all 38 countries in that survey. But it was the largest relative increase between 2009 and 2016. Of course, the new curriculum that came into being in 2016 also emphasized moves in this direction. And there was a recent study actually showing, and that got a lot of attention in Finland just a couple of days ago, that showed that highlighted the negative effects of these methods in, I think it was PISA 2012, 2015. Don't quote me on that because I haven't seen the study. I couldn't find the study, but I couldn't find the article in Yle. So it's pretty clear that Finland has moved in that direction. But overall, it's still quite traditional compared to the other Nordic countries. Why is this important? Well, because existing research suggests that traditional teaching methods are clearly preferable from progressive ones from an overall learning perspective. So traditional methods are simply better at improving test scores, but also longer-term educational outcomes. So both these things that we talked about were important for health. Overall, it's also the case that the evidence base suggests that more traditional methods and also hierarchical school environments, this old, angry Herbart-Sillerism, German pedagogical ideas, are actually especially good for improving performance among disadvantaged pupils. Okay? Which, of course, links to this question of health equality, because if cognitive performance and non-cognitive performance is important for health, if we have a pedagogical system that favors more advantaged kids, we should see a slight or increases in inequality. There's actually little evidence that progressive methods are particularly good for any kid, apart from, and this is what I found when I did a literature review of gifted education. It turns out that very gifted kids and very high achieving pupils do benefit from these methods. But that also suggests that we would increase inequality, right? But there is some evidence for that, so I should highlight that. At the same time, and this is important, at the same time, the progressive methods are not at all bad for everything. I mean, remember, one of the key goals of these educationalists was to improve well-being, and it turns out that these methods appear to raise well-being at school in general. So in contrast to what progressive educational theory predicts, there appears actually to be a trade-off between achievement and well-being at school. It's not only in terms of progressive methods, but in fact, if you look at reforms and interventions that have positive effects on educational outcomes, they often decrease joy for learning, okay, decrease pupil happiness, worsen relations between teachers. So Finnish kids do not like their teachers, by the way. UNICEF had a really good report from 2009, and I think the English conclusion was they have an extremely negative attitude towards teacher, which I thought was a bit too much. But in any case, it stands out they haven't been particularly happy in school, but they have been better at the other stuff. No, you may not, so you have to wait. And in fact, I also have some evidence myself, so you can comment when you have the time. I did an analysis at the pupil level using PISA data from all Nordic countries, and now including Iceland, and looking at this index of pupil-centered teaching. And I saw the relationship with that and PISA scores and pupil happiness, because PISA 2012 was the first time they asked them, are you happy at school? And I adjust for a wide range of background characteristics, as well as comparing only children within the same schools, okay? So we don't get any selection bias into the specific school. And we focus on the gray bar here, and we can see that This index has a negative impact or relationship with average PISA scores and a positive impact on pupil happiness. And in the report, I also show a similar relationship in cross-country regressions at the OECD level. And given the evidence, it's not surprising that pupil performance trend is disappointing. So we've seen the decreasing performance in Finland, Sweden, and Iceland, pretty stagnant in Denmark and Norway. Also important to remember, between 2012 and 2015, those changes are not reliable. And that's because the OECD changed to computer-based assessment, which research suggests has an impact by itself. In fact, they highlight Norway and Denmark that those scores are not reliable specifically. They single them out in the appendix because those children in Denmark and Norway have apparently more experience of using computers in instruction, and that seems to be related to changes in performance. So overall, I would say a pretty dismal picture. At the same time, what has happened to school enjoyment? Well, I used the data from health behavior in school-aged children, which I think was the subject of a seminar yesterday. There's a question called I like school. I standardized this, and this is what we see, the increase. So we see that's the decreasing performance, increasing school enjoyment among 15-year-olds at the same time. And these are not small increases. Look at Denmark. That's about 0.2 standard deviations. So that's significant. Suggestive of this, basically the trade-off as well. But there is little reason to suggest that improved school enjoyment has improved mental health. As we heard yesterday, it's actually decreasing mental health. This basically, I took this index again, and I created a mental health index through or the survey, and I created a mental health index using different questions. So we can see that it's declining in all countries apart from Iceland, where they actually were not participating in the 2001 one. So we see mental health actually moving more in tandem with performance, not school enjoyment. It's difficult to draw causal conclusions from this, obviously, but the patterns are broadly consistent with a trade-off between pupil happiness and achievement that I highlighted, as well as the evidence on the impact of knowledge and skills on health and health equality. So what are the implications for health equality? What should we do about it? Well, first of all, I conclude it's reasonable to conclude that the pedagogical methods utilized in Nordic countries are likely to be harmful for health equality via lower education quality and equity. While the progressive philosophy induces more positive immediate school experiences, it decreases pupil performance, which is likely to have consequences for their health and generally health equality in the long-term perspective. To decrease health disparities in the future, I suggest that the Nordic governments to some extent alter their current education policy trajectories. Rather than pushing forward in the same direction that we've been doing since 1945, toward more pupil influence, more child-centered methods, Finland is just the most recent example of falling for this, it would be more reasonable to move in a more evidence-based direction. I'm not saying, we should force all schools to do one thing. But it does include, it's a lot of things we could do, but it includes reviewing, adapting curricula, policy documents, material and teacher education, school inspecting guidelines, other key features of the education systems, and to move them more in line with the research. Of course, it's not easy to accomplish this, and there is no direct link between policy and the methods adapted in schools, as I suggested. But still, ensuring that policy at least encourages moves in the right direction, or at the very least does not encourage further moves in the wrong direction, would be a step towards creating education systems that advance more equal health outcomes in the long-term perspective. Thank you.